Warfarin is the main oral anticoagulant used in the UK. And anticoagulant means a medicine which reduces blood clotting. And if you already knew that, then let's move on to the next part. I see many patients on Warfarin every day, and they're very knowledgeable about their medicine, which is fantastic. But here's some information about Warfarin which you may find useful. And if you can tell the strength of this Warfarin tablet just from its colour, then leave a comment below and I'll let you know if you're right. I won't be going into super detail about Warfarin in this video, as it'll be over an hour long. But what I will do is give you the main points, and I'll also leave some information in the description below with some great links. Or just speak to your amazing pharmacist. Okay, so Warfarin works against vitamin K in the liver, which is essential for the production of clotting factors. And without clotting factors, it takes the blood longer to clot. And that was a super simplified version of how it works, which I wish it was that simple at university. So why do we need anticoagulants? Well, they're very useful for patients with conditions caused by clots, like strokes, heart attacks, deep vein thrombosis, and pulmonary embolisms. They're also useful for patients who are at risk of having a clot. So let's say you've got atrial fibrillation, you've had a mechanical valve fitted, or you've just had surgery. Now let's move on to blood tests. With Warfarin, it's really important that you attend your regular appointments at your anticoagulation clinic, so they can check your INR and make sure your dose is correct. INR stands for International Normalised Ratio. It's a value that determines how fast your blood clots. A high value means it takes longer for your blood to clot, and a low value means it clots faster. Someone who's not on Warfarin or any anticoagulant like me will have an INR of 1. But if you're on Warfarin, your doctor will maintain your INR at the therapeutic range. Now, it's really important to have your INR monitored regularly, because if it's too high, you're at risk of a bleed, and if it's too low, you're at risk of a clot. And many things can affect your INR, such as certain medication, certain foods, drinking too much alcohol, herbal medication, and even supplements. So with any medicines, herbal medicines, and even supplements, always check with your pharmacist, GP, or staff at the anticoagulant clinic before you take them, as it might interact with your Warfarin. And with food, there are many foods which contain high levels of vitamin K. So theoretically, it works against Warfarin, like green leafy vegetables such as broccoli, spinach, kale, as well as vegetable oils and cereal grains. But it's important to remember that you don't need to eliminate these foods from your diet. Instead, keep your diet consistent. So, if you're used to having a kale salad every day, have a kale salad every day. But what you don't want to do is have loads of vitamin K rich foods one day and then none the other few days, because that will affect how Warfarin works. So keep your diet consistent, and if you're thinking of making any significant changes to it, then speak to the healthcare professional that's responsible for your care. I've also left a link in the description below which gives you all the foods and drinks that interact with Warfarin, and it also explains about cranberry juice and why you should avoid it whilst taking Warfarin. Okay, so the yellow Warfarin book. Everyone in the UK who's on Warfarin will have one of these books, and it's got loads of great information about Warfarin in there, your dose, and your INR, okay? And it's really important to carry this little card with you at all times and fill it out in case of an emergency. That way, the healthcare professional who's treating you will know that you're on Warfarin. The yellow book also has some great information on side effects, missed doses, and when to seek medical attention. Now, unfortunately, we've run out of time to talk about all of these, but I've left some great links in the description below, and I've also left a link to an online version of the yellow book for you to read, so definitely check it out. And that's it. You now know more about Warfarin, how it works, INR, and its interactions. And don't forget to leave me a comment if you know the strength of this Warfarin tablet. And with all medicines, always read the information leaflet. Hey guys, thanks for watching this week's video. Make sure to click that like, follow, or subscribe button now to stay up to date with new weekly videos. So with any medicines... Right, the yellow Warfarin, I don't know why I looked there just then.